Right. Thanks, Deborah, and thanks, everyone. And it's my pleasure to be here as a second year in a row. And my name is Fabio Gomes. I'm a consultant medical oncologist. I work in Manchester, but you can tell that I'm probably not from Manchester. So, and people tend to think, oh, first name Fabio, maybe it's Italian, last name Gomes, maybe it's Spanish, but I'm Portuguese. So I came from Lisbon nearly 9 years ago with the plan of coming to Manchester 1 year, go back to sunny Lisbon, but I stayed in the not so sunny Manchester, but I'm happy there. And last year I came to give a bit of an overview about the ALK education project. So for those who were here last year, this will ring a bell. The others are wondering, what is this about? So I have a few slides just to take you through that. So some repetition perhaps in the beginning from last year, just to bring us all on the same page. And you can stop me at any time, although we have some Q&A at the end, but if there's something, just raise your hands. So back in 2018, and I've been subspecializing in lung cancer since I moved to Manchester, and ALK has been an interest of mine for a while. So myself and Dr. Yvonne Summers at the Christie in Manchester, we felt it would be really good to try to pull together a big database to understand what was going on across the country for patients with ALK positive patients. So we reached out to many, many colleagues across the UK, England, and the 4 nations. And then we had a lot of support. So we built this ALK project essentially as a collaborative database, everything anonymized. And actually, even perhaps some of you in this room, but there were many patients that were actually telling their clinicians to participate in it. So it was quite an interesting project. And that was essentially looking at what are those patterns of treatment, what is happening to patients with ALK positive, what are their outcomes. So we ran that. And amongst several findings, and that's the purpose today, is not to discuss that project, but one of the findings was a recognition that there was a need for a little bit more education, perhaps, because the ALK field has changed so much and so quickly. And if you think about some smaller centers, they might see 1, maybe 2 patients a year. So how can you empower those teams to feel more confident, but how can you also empower people like yourselves in the room to ask the questions, and to feel a little bit more confident on what those next steps might look like. So we said, well, one of the things we need to do is thinking about something more than just a data capture exercise and reporting, but the education component to it. Then COVID happened, so the ALK project stopped, but shortly after we've managed to secure some funding to launch this educational platform, and that's where this ALK education program came about. So what is it? So it is a web-based platform that we've been working on, and with the purpose of having multiple different contents and in different methods of learning that is focused on ALK, and that is done and built for different audiences, because we recognize as well that if we want an oncologist to potentially use it, or CNS, if we want the nursing team, trainees, etc., maybe the language is potentially a little bit different than the public in general might want as well. What about the GPs? Do they need the same level of detail? So we felt that maybe we needed to make it work, we needed to tailor it, and we've designed it with 3 different modules with 3 different targets. So one is very much focused on the more specialist oncology teams. That would include as well some people working and colleagues working in secondary care, but they are involved, for example, with the diagnostic part of the pathway. So they are much more engaged, much more aware. So that's one module. Then the other module is more focused on primary care, but also some secondary care where those colleagues perhaps aren't as involved and aren't as aware as the others. And then we have the third module that it's for you and for the public in general and for the patients. So we've been working on those 3 and prioritizing the module for the patients. And then we had a lot of discussions, where do we go from here? There's so much we can cover. How do we organize that? So we came to, 2 decisions. One was we needed a feel of a pathway. So we wanted to structure it, as you can see there. We wanted to start by what is ALK, focus on the diagnostic part of the pathway, then focusing on the treatment part of the pathway, focusing on additional support that can be provided, and essentially have that feel of a pathway. And then we felt, but even then, how can we make this even more interactive and hopefully more user-friendly? So we've structured that within each part of the pathway, everything is structured as a frequently asked question. So instead of just going through in a potentially more boring method where here is an introduction and you go page after page, we have frequently asked questions as a way to navigate through. So hopefully we felt, and with our engagement, we felt that could be a good way to do that. And that is the same principle for all the modules. For healthcare professionals or for patients, that is exactly the same. So the program has three aims. One aim is to educate, obviously, so it's an educational platform, and again emphasizes not just for patients and it's not just for healthcare professionals, so there are different modules. One thing to highlight is if you go onto your model, but actually you feel like, well, I actually would like a little bit more detail, and this isn't the right level for me, you can freely access the other content as well. So it's bespoke, but you can. So you're not limited from accessing the others if you wish to. Then the second aim is to empower. So we want to empower clinicians and teams to feel more confident with that rapid changing landscape of ALK treatment, but we also want to empower you to say, well, actually, why are we doing this? Why not this? Or what about that? Knowing what to ask and feeling a little bit more empowered, so when there are decision-making moments, you can be part of it as much as you want to be. And then the third aim there, I think it will depend really much on the uptake once it goes live. So one of the things we wanted is to then use this potentially as a platform for updates. As new things comes out, we would provide updates, adjust the wording and how we are providing that information depending on who is on the other side. But that aspect obviously requires quite a lot of frequent updating, and that will depend as well on the overall usage of the platform. So if we feel there is quite a lot of uptake, obviously, depending on who is using it the most, because one of the things we've been saying that we might want is no one needs to register, but we might ask every time you access, are you a patient, are you a healthcare professional, etc. And then we will have some analytics just running behind to understand what are the parts of the website that seem more popular, that seem more relevant to people, and where are you logging in from, things like that, to try to map out so that for this to be sustainable long term, we might evolve and adapt to develop more the things that seem to be more useful. And as time passes, hopefully we will develop that last aim of keeping things as up to date as possible as well. So who's involved? It's definitely not just me. So there is a big team. So we have the Christie School of Oncology in Manchester that really has been the driving force developing a lot of these contents with us. We got a grant, so we got an independent educational grant from Pfizer, and it's important to acknowledge that because obviously it comes with costs creating all of this. And then you'll see some names there because we felt that each module needed some leads. So you see the names there, but there are a lot more people involved within each of those modules as well. These are just the leads shaping them and approving content, signing off content, and supporting the rest of the team. Now, you'll see as well there, a little bit dark in the corner there, but there is Claire and Alex, and they've been absolutely crucial. Without them, I don't think any of this would have happened, regardless of our best intentions. So a big thank you to them as well. But we came here last year. So again, some of you were here, so you'll remember me and my colleague Rachel, we were running around trying to talk with as many of you as we could, and we did our workshop. And there are some pictures there, and this was our engagement piece. So we started with you before we started doing anything. We engaged and we asked you questions, and that was the basis for us to start developing the content for the patient module. But also we took some of what you've said to shape the modules for the healthcare professionals. Are there things you wanted your healthcare professional to say or to ask or to provide you that you didn't have, for example? So we've been pulling that as well into those modules. And there were some questions, and we're not going to go through all of that, but some of the things that came out of it. So one of the questions was, what are the main questions that you would like to see addressed as part of the platform? And as you can see there, you have the word cloud and you have the pie chart, but essentially treatment options. I think that was one of the key things that came out of it. People wanted to know more about treatment options. A lot of interest as well, actually, around the side effects. But on the genomic testing, I'll be frank, I was surprised there was so much interest on genomic testing. So we have quite a lot, and you'll see some of it as I go through, but we have quite a lot on that as well for you to understand a little bit more about the challenges, the practicalities, and how this happens across the UK as well. So this was just to give us a bit of an overview of what were those things that you wanted to see addressed. Another was, is there anything that you wish your healthcare provider had told you or asked you about? And again, you can see quite a few themes emerging there, and a lot of it was actually around the support. And that's why we felt that we have a whole section dedicated just to the support. So yes, we're focusing on what is ALK, the diagnostic part of the pathway, the treatment part of the pathway, but we have a whole section just on support. And that came from this as well. And then this one was our attempt to think, well, there are many ways we can deliver that educational content back to you, but what is your preference? And with no surprise, everyone likes things differently. So a lot of people like video, a lot of people like animations, but there's not going to be one size that fits all. So we have a huge combination of different methods. Try to make it as less boring as possible and as interactive as possible as well. So, and I'll skip this one in the interest of time. So what happened? So we came here, did that workshop with many of you, and I'm sorry if I'm repeating some of the things from last year that you know already. So what happened after that? So we did that engagement with you, then we went back and did the engagement with healthcare professionals because we had 2 other modules that we had to plan for. Based on all of that, that's when we started building the draft and the outline for all those different questions. What are those main questions? And then after that, we started building the content under each one of those frequently asked questions. We now have a website, so the website is being built, but we have a website, and we've been working on that website since the beginning of the year because we can develop all the content. If the website doesn't work, we don't have where to put it. So that has gone live as well, and we have a name. And this was a lot more challenging than I thought it would be. How do you find a name for it? And how do you agree on it? And we're gonna officially let you know today. So that's exciting. So with that, and I know we don't, I was joking with Alex and Claire that we don't have drums, but imagine the drums in the background, the lights lower, and it's happening, and the confetti cannons are ready to go. And this is it. So welcome to ALK Knowledge. That's, and I hope you like it. So it took a little while, but we got there. Because it was both things, is what is the name, what is going to be the color scheme, all these things I never thought that we would have to think about, but you have to. So yes, so we came down to this one. And I think it's fairly simple, and obviously this is going to be linked with the website name as well. So maybe at this point I will ask Claire and Alex to join me here, just to take you through a little bit about what is happening. So the website isn't live yet. It will come live by the end of October, but we can do a little bit of a short demo, if that's okay. Over to you.
You're better at the technical than me, Claire. So this is literally hot off the press, everyone. So it's not got any content in it yet, but we still wanted to show you what it's going to look like when it goes live next month. So yeah, this is the ALK Knowledge website. Hopefully it's going to be really easy for you guys to use. We've got the bar at the top here with all the different modules, the patients, healthcare professionals and the specialists. We've got a resources and about section as well. If we just scroll down here as well, you can have a little bit more information on each of the modules. So the specialists who we're targeting there, the healthcare professionals, not with people with no lung experience, specific lung experience, and then the patients one here as well. So if we just click on this, it's going to take you to your section. Do you want to talk about this?
Yeah, of course, yeah, absolutely. Oh, thank you. No, you're fine. So this is the patient module, and as we've said, you can sort of dip in and out of the different areas if you want to. But on here, we'll have different forms of content. We'll show you some examples shortly, but you'll be able to see that we've got lots of interactive content, lots of videos. The website's kind of laid out as a sort of like pick and mix offering, really, so you can, you don't have to read it from start to finish. There's a lot of information here, but hopefully it's kind of laid out in a way with these sort of FAQs down the side here that you can just find a bit that's relevant to you at any particular time and read that, basically. So it's not that you have to read the whole thing, basically. And we've taken it from a lot of your feedback. So there's one piece of feedback that we had was that a lot of people were really interested in that kind of more detailed scientific information. So we've made sure that's included, but it's quite clearly labelled. So if you want to read that, you can, and if you don't have to, or you can read it later. So there's a lot of kind of choice involved, really, hopefully. Do you want to? Yeah. You're better at navigating than me.
So yeah, the sections of the patient's journey here. So we're on what is ALK at the moment, and then you can click through to diagnosis, treatment and support, and each section will have its relevant frequently asked questions in. And then over at the top here, we're going to have a resources tab. And this is so if you've looked at the website and you've seen an external link that you want to go to, a document that you want, a new paper, a clinical trial, everything will be really easily searchable here as well, so you can find it. And hopefully we'll have a function that's like the most up-to-date, so you can search it by the most recent and relevant information as well. And then obviously, as you've seen, a lot of people have helped contribute to the website. So we're going to have about section as well, so you can see all the experts that have helped create the modules and provide their expertise. So yeah, I think that's a good whistle-stop tour of it. Yeah.
Oh, thank you for that. So it is a work in progress, but actually there's a lot more that is already done. It's just not on the website yet. So by the end of October, that should be going live. Thanks, Alex. Thanks, Claire. So to give you just a little bit more detail, so that we may be perhaps a little bit general and top level, but just to give you a little bit more detail, because I like specifics. So what is it that it's in there? So we said we start with the what is ALK and that initial overview. So these are just some of the examples of questions that you're going to find in there, and you'll be able to navigate through. And maybe we'll go next just to give you one of the videos. It's always odd to see myself on the video, but there's more people than just me, which is good. But we'll just take you through one of the videos that you'll find on the website. Thank you. Welcome to ALK Knowledge. This is an online platform that offers educational content on ALK-positive lung cancer. And the reason behind it is because the way we manage ALK-positive lung cancer has really been revolutionized in the past few years. So we hope you'll find this content beneficial.
ALK-positive lung cancer is what we call a targetable mutation-driven cancer. And really what that means is that there's a gene within the cancer that has changed to be driving the cancer cells to multiply. ALK stands for anaplastic lymphoma kinase, but the name of the gene doesn't really matter. It's not relevant to what it's actually doing in this situation. When we're talking about genes here, though, it's really important that both doctors and patients are aware that this does not mean that it's hereditary. It's not passed down from generation to generation. It's a gene that's changed within a cell rather than something you inherit.
ALK-positive lung cancer is a subtype of non-small cell lung cancer, and that happens because there is a mutation in the ALK gene. And to be a little bit more specific, it's a fusion mutation where the ALK gene gets a fusion with another gene, most commonly a gene called EML4, and that creates a hybrid or a fusion gene. And when that happens, it's triggering that constant signal for the cell to grow and replicate. It's like having a switch turned on, constantly sending the same message.
So the typical characteristics of someone who will have mutation-driven cancer, such as ALK-positive lung cancer, would be that they're more likely to be female, they're more likely to be young, they're more likely to be of Asian ethnicity, and really importantly, they're more likely to be never smokers. And that's critical, really, because we know this group of patients are very frequently diagnosed at a later stage. Quite commonly, they've had interactions with healthcare professionals on a number of occasions before they're ultimately diagnosed, and very frequently, sadly, they present as emergencies through the A&E route with symptoms of metastatic disease. So part of the reason that we're doing this project is really to raise awareness of this really important patient group. And it's not, although it's relatively uncommon within lung cancer, actually never smoker lung cancer is actually quite a common disease. It represents 15% of all lung cancers. And actually, if you look at never smoker lung cancer, it's the 5th commonest of all cancers in the world. So it's really important that we start to think about this group of patients.
Whether you're a patient, a family member or a healthcare professional, what I would like to stress is just how positive it's looking for treatments for ALK positive lung cancer. In the last 5 years alone, there have been 3 new treatments become available on the NHS, and there are further treatments in development. So it's all looking very positive and will hopefully support us to live very long and active lives.
So when we're thinking about treating ALK positive lung cancer, we have a whole range of treatments, and those are called targeted treatments. And they are drugs that have been developed with a target in mind. So if there is a specific mutation like ALK, that's what that treatment is going to target. Those treatments work really well, but they only work if that target is present. And they might be referred with different names. So they are, as a class, they are targeted treatments, but they can also be referred to as the ALK TKIs, and that's a tyrosine kinase inhibitor, and that is just the mechanism, how they actually work within the cells, or they can be simply just called ALK inhibitors.
Throughout the site, you'll be hearing from other ALK positive patients, and I really do believe that this will help you understand ALK positive lung cancer more, and also support you, if you're a patient or family member or friend, to live as positively as possible.
Right, thank you. And you can tell it was sunny in Manchester, which is unusual. It was not raining, so that was a special day. So thank you. So this is an example of one of the videos that we'll have, but we'll have a lot more, and some of them will be like this. So you'll have some interactive functions where you can click around, have short information, again, questions within questions, just to try to guide you as much as possible. So we moved away from having just, a big chunk of text for you to read and decipher. So we have that, and we've put some examples here around what is ALK. And then the second part of the pathway was around the diagnosis. So again, an example of the questions. And as I've mentioned, there was a lot of interest around how is ALK tested, what are the challenges, how long does it take? Some questions were on the technical side. So you got a biopsy. How do we go from a biopsy to this result? So we had quite a lot of different bits of information on that. We even got Dr. Matt Krabs, who is the Northwest lead for the genomics hubs. So it's going to give quite a good insight about how does this actually work once the biopsy is taken and is sent to the lab. So we'll have a lot more detail, but again, you can go as deep as you want it to be. And if you find that the information and the level of information within the patient model is actually not enough and you want more, you can just go and flip to the other modules where there's going to be a little bit more detail, a bit more technical, and you can use it and navigate through that as well. And here, this was one, again, this is us trying to give you as much as we could before the website goes live, but this is just showcasing symptoms. I think there were a lot of questions as well from people around the symptoms, and some people saying, why was my cancer diagnosed at a later stage, and I didn't have the symptoms, or the symptoms weren't identified, apologies, as lung cancer. So we have quite a lot on the symptoms, but also on the staging. Understanding and explaining what are those differences between stage 1 when it is localized to the stage 2 when it gets more locally advanced, and with some images to try to explain as it gets regionally advanced to the metastatic setting. And we know that sadly the majority of people get diagnosed with advanced stage, but hopefully we'll see a shift on that over time as well. And now moving on to the treatment section. Again, a whole array of different questions there. A big hot topic was around brain metastasis being quite a common finding, so how to deal with that. So we have sections on that. And clinical trials was also a big thing. So we have a whole section around clinical trials, and Sharon Woolley, who leads, so she's the lead nurse of our research team at the Christie. Here's a short video from her.
Clinical trials are really important in cancer care. They help us improve patient outcomes. They help us understand the side effects of treatments, be that chemotherapy, immune therapy, targeted therapy or radiotherapy. But they also help us understand how those treatments impact on patients' quality of lives. So there are various different types of research that we conduct here at the Christie and throughout the UK. In cancer patients, we will be looking to see whether we can give a particular drug for a particular type of cancer, or is there a radiotherapy technique that we can give to them, or by donating a blood sample that will help us look at different targets and help some of the lab work that we do around research. And every part of that is an important part of improving those outcomes for our patients with cancer.
And we have Duncan, who I think I've seen somewhere. Oh, there he is. Just another brief video for you. Thank you.
The first is just trust in the process. It takes some time, but I think we don't like to use the word lucky when we talk about lung cancer or ALK positive lung cancer, but we are blessed with a set of very effective treatments that give us options and then also give us hope that those treatments can actually make a real difference for us. So when I talk to other patients with ALK positive lung cancer about this, I always try and say to them, look, don't jump to conclusions about what's going to happen. Don't be pessimistic, but don't be too optimistic either. Just try and sail a steady course and wait and see what you find at those when you get those scan results in, because there's real hope. There is real hope that you will respond effectively to the treatments that are available, and that you'll be able to live a happy, normal life.
Thanks, Duncan. So we have quite a lot of you participated and got involved. So we have quite a lot of content made by patients as well. And then we get onto the section around support. And as I said, there was quite a lot of it. So we have quite a lot of content in there as well for you to navigate through. And this is another video. So you'll meet Deborah, who obviously you know, and Del. So Del, she's a specialist nurse, and she co-leads with me the module for the specialists oncology.
One of the things you mentioned, Deborah, was about scanxiety and the anxiety that patients, yourself and other patients experience when we perform CT scans, usually 3 monthly, and also when we're conducting MR head scans as well for surveillance for brain metastases. And we appreciate, again, we have a snapshot in clinic of patients' anxiety around this. Can you talk a little bit about the anxiety that yourself and other patients in the ALK Positive support group experience, and how you manage that, but very importantly as healthcare professionals, how we can support you with that?
Yes, anxiety is a real issue for patients, but everybody deals with it slightly differently. So some of us are able to put it in a box and just go, well, there's nothing you can do about it. It is what it is. So you might as well just forget about it and carry on. Others find that more difficult. And so I think being able to talk it through with their nurse teams really does help. And it may be that they can get extra help through, psychological support that nurses would be able to direct them to if it's available in their local hospital. Another area that I know some of our members have benefited from is making contact with their local hospice for getting, relaxation massages and things like that. That's helped them during that time. Excuse me. And the other thing is being able to talk to other ALK patients, because there's nothing like talking to someone who knows exactly what you're talking about. So they can be incredibly supportive, non-dismissive, but also a little bit of, you need to put it aside, book lots of things in your diary, lots of little things, coffees with friends or walks out with friends, or it doesn't have to be big things. It doesn't have to be expensive things, especially with the cost of living crisis as it is. But it could be little things, meeting up with a friend, or making sure you have a conversation with family far away. That book lots of different things in that you're doing that keep your mind busy, because it's your mind that starts playing tricks on you.
So with that, a big thank you. And I think it's a big thank you for you because you've engaged last year. And as I said, several of you, and we've put some names only of so there are some other people that did help but prefer not to have their names up. So obviously we didn't. But there's a lot of people helping us. And we just want to say a big thank you. And maybe asking Claire and Alex to come back up to stage. And a big thank you to them. If you don't mind coming this way, trying to drag them out of the shadow. And, this is an invite as well for you to continue being involved. So we're still looking for people that would like to test the website before it goes live. We'll also want very much to have feedback over at least the first few months, because we will have the teams much more, engaged and with time allocated to work just on this, so it makes it easy for us to make changes. But also providing us some written testimonial, I think that would be very welcome. So you obviously can approach Claire and Alex throughout. They'll be here throughout the day. Apologies that I'll have to go afterwards, but you'll have their contacts as well on the page there. So thank you for listening. We were saying that the website will be going live by the end of October. So we'll ask Deborah and the charity to make sure that gets circulated, so once it goes live, and you can start playing with it and sending us some feedback. And then the rest will be coming out in the following months for the healthcare professionals. But again, once you start using it, do send us feedback, criticize it if there are things that could be improved. I'm sure there's always room to improve. Just let us know, so we can make those changes. So we would really ask for that feedback. And with that, if you don't mind just using your mobiles and scan the QR code, we just have some questions on feedback on what you've just seen, and us trying to understand a little bit more how can we keep you engaged, and how can we ensure that this is helpful for you long term and not just a one trip on it, but how can you stay engaged with it if that is helpful. You might conclude that it isn't that way, and we will change and adapt it over time. And I'll stop there if you have any questions for us. Thank you. So I know there are 3 mics going around. Oh, there's one. Yeah, Duncan.
You expect me to ask a question, don't you? So I'm kind of interested in what's going to happen around the comms strategy for this as the website launches, and I can figure out fairly well how it's going to work for patients, because it's no doubt going to be through our charities like ALK Positive and Ruth Strauss and Roy Castle and things like that. I'm more interested in what you're planning to do around comms strategy for healthcare professionals, both primary and secondary.
So one thing that we've acknowledged is that we've been focusing quite a lot on the website and not so much on the comms strategy. But we've had some discussions, and one of the things we're thinking about for the healthcare professionals, so we are going to submit this to BTOG. So we're going to submit that as an abstract. Hopefully it will be accepted. And then we plan to present that at BTOG as well. So that is one. Then we've had already some conversations about circulating this within the forums for the lung specialist forums. And we can maybe talk a little bit more about that. A lot of it might be word of mouth, but I think we're just trying to think what are those main forums where you'll have more healthcare professionals in the field of lung cancer. This is more targeted at UK level, but we'd be very happy for that to be used more widely. But I think we will be focusing more on the UK healthcare professional before we think beyond that. And then we will have our own platforms for comms within the Christie and our School of Oncology that we're going to use, but I don't think we've formed up absolutely that plan yet. But we are welcome any suggestions, but we don't have that fully finished. We've started talking about that probably 3 weeks ago. Do you want to add something to it?
Yeah, I've not got a microphone anymore. Just to say, also at the Christie, we've got a team called Gateway C. I don't know if you've heard about these, and they're really targeting primary healthcare professionals, so the GPs, and we work closely with them as well. So that's another resource we can tap into to try and reach the, the specialists and the GP market as well.
That's what I was going to say. Perfect. Yeah, absolutely.
Yeah, so just because I don't think you had the mic, so just I think it was for the purpose of recording. So Cancer Alliances was the question, and yes, so we've already engaged with our own Cancer Alliance in Greater Manchester, but we'll be reaching out to the others as well.
Is this on? Oh, it's on now. So I'm Karen Clayton, I'm a clinical nurse specialist. One of the things that I was just thinking off the top of my head really was, obviously we give a lot of information to patients when diagnosed, and being able to give leaflet or something to direct them to this website at that point would be a good thing for the nurses to have.
That's a great idea, and I think we can definitely produce that and circulate that. So I think it could be a really good output for this as well. Good idea. Yeah. I think I saw a hand somewhere there. Yeah, if there's a mic. Yeah.
Hi, you mentioned about updating the website and having sort of resources come to the top when they're new. And I'm interested in what system might you have if you're a patient, you've read, or a healthcare professional, read the website, then how you might be sort of notified if there was updates or new information, because that will be quite useful after you've read the initial information.
Yeah, it's a really good one. It's a really good one, thank you. I think that's probably something we will sort of look at as a kind of phase 2, because I think that's a really good point. At the moment, we the website currently won't sort of record your data when you visit at that moment, but it is something we could potentially look at later as an ongoing communications channel. But I think, yeah, having it updated is really key for us, because we want people to be able to come back time and time again. So it's definitely something that we are going to be looking at. Sorry, that's a bit vague, but exactly. Yeah, absolutely.
Yeah, I was thinking that could be a good solution, because we're not asking anyone to register, so you don't have a login to register and get a personalized message. But maybe what we can have is just a sign up to a newsletter, and that newsletter comes from time to time for everyone who signs up. So you still don't have to provide all your details to have a login, but you just sign up to a newsletter. I think that could be a really good function, because you're right. And I think that was sort of that third aim, the connect, is how do we keep that up to date? But if people don't know, you're not going to just go into the website, let me have a look around. So I think that's a good point.
Can I ask Fabio, website, similar to what you've been saying just now, websites are accurate on day one. What's the commitment with this for year 5, year 10, and onwards?
Yeah, so we have debated that quite a lot, because we had funding to set it up. We don't have funding to keep it up to date. We've done a commitment within the Christie that we will dedicate some time for that. We might be looking at venues for some funding to have a little bit more time dedicated to that from our team, especially if we need to develop more content. That's where most of the cost would come from, because my time providing a summary of a paper, that is fine. I guess then if we need to develop new content, videos, obviously there come costs with that, and that is the part that we still don't have. And we'll be looking, as soon as it goes live, we'll be looking at, so we already have the funding for the sort of the website domain and maintenance, because there's a cost associated with that as well for a few years, so that has been sorted. But what you're saying is about how do we keep this relevant and up to date as things change. So that we're still going to be looking for funding, but we have a commitment, still a minimal commitment, that a lot of that will be done in-house to keep some degree with some frequency, which we haven't agreed yet, if it's going to be every 3 months, every 6 months, an update on the main developments, and that might be the time that the newsletter gets sent out. The one thing that we still haven't secured is that funding for more in-depth content development, and that's why even while we've planned, the videos that we have are the things that we feel will change the least. So, because the videos are the most expensive ones to produce, so the treatment section essentially has no videos, because that is the section that needs more updating. So that is, in terms of, I don't want to put words in anyone's mouth, but I think that is the section that, in terms of production, is the cheapest that we have because it's the one that we need to update more often. Is that a fair?
Yeah, absolutely. Oh, sorry, sorry, that's absolutely fair. We do, within the School of Oncology, we have a digital learning team, which I'm part of, and we produce a lot of sort of digital learning, and we have a regular cycle of keeping that up to date. So you can rest assured that we would not let anything stay on the website that wasn't currently accurate. We're very used to that kind of product cycle, so we'll make sure in one way or another that it's always up to date for you.
There's one hand at the back.
I'm afraid I'm
Yeah.
greedy. I've actually got two questions.
Yeah.
I appreciate that the website is wonderful and it is focused on the actual patient. However, what about the supporters? Is there anything in the website which will help the people that are trying to support the patient, who aren't medically minded, they're a relative or a very good friend? Is there anything on there?
So I would say that the module for the patients is very much relevant to them as well.
Yeah.
There's a whole section just on the support. So I would say that they should be able to find all the relevant content there. And that content is shaped not to be medically minded or too technical. So that has been bespoke to both the patients, but also their friends, family, and the public in general. If there are aspects that you feel like, oh, actually, I needed a little bit more detail, then yes, you can dig a little bit more and go through the other modules. But that module has been shaped exactly for that.
My second question is, I believe, it's unfortunate, obviously, for the people that are here, but prevention is better than cure. And I feel that if there was an earlier diagnosis, which could have come about, when the patient goes to the doctor, they 9 times out of 10, they will do blood tests. Why, in my experience, do GPs not obviously have X-rays as one of the things that they should be doing as one of the normal routine things? Because it would have been picked up earlier for, I'm sure, a lot of people here if they'd have had an X-ray early on.
Yeah, and
if they're asymptomatic.
I think we can all agree with that, and that's.
Yeah.
So
in your thing you say about empowerment GPs, is there something in there that could be mentioned to them, that it becomes a statutory thing?
So I don't think we have at least the power to do that, but we have the power to influence that.
Yeah.
And that's why one of the modules is targeted at them. So out of the 3, so we have one that is for patients and public in general. There is one that is essentially targeted at the GPs for that exact same reason. And the link that they've just mentioned with Gateway C, which is a national educational platform for GPs, is the way to try to make the GPs more and more aware and influence that. Because I completely agree.
Because there seems to be an element whereby if a patient goes to the GP and they look at lung cancer, and they seem to think if you don't ask the question, do you smoke, and they say don't smoke, then it's brushed under the carpet. It's ignored. Yeah. I'm just wondering if they could be educated more in that respect.
So I would argue that a lot of the content. So once you have a chance to play around with it, you'll notice as well that. For example, for the specialist module, we focus a lot more on the treatment side of it, so there's a lot more detail there. But for the GP module, it's essentially focused on the symptoms, what is ALK, and the diagnosis part of the pathway, because that is the part that they get involved with, and that is the part they need more training and more awareness as well. And you're right, I think it doesn't come to mind if someone never smoked. People aren't necessarily thinking about lung cancer because sort of one thing comes with the other, and that's the way it has been. But my colleague, Dr. Grundy, said it on the video that the proportion of patients with lung cancer that never smoked is quite significant. So that awareness is key. So yes, and that's why a whole module is just for the GPs. It's essentially targeted at the GPs, and that is the message in that model across it.
Thank you.
Can I just add to that? Because over here, sorry. What you may not know is quite a lot of the regional cancer alliances are running programs on early detection of symptomatic lung cancer. And all those programs include modules on lung cancer in never smokers. And there's there's at least 2 regional cancer alliances, and Greater Manchester is one, and I think the Northern Cancer Alliance is the other, that are running these programs. And both of them, there's a plan to ultimately get funding from NHS England for it to be a program that's rolled out across the whole of the UK, of England. Things operate slightly different in the other nations, but it's not an area where nothing's happening. Things are happening in that space. It's just everything in the NHS tends to go fairly slowly.
Thanks, Duncan. I think there was a hand back there.
Hi. Firstly, congratulations on such a good website. I just was thinking about healthcare professionals who aren't specialists in lung cancer. The main thing that they struggle with is time to access this kind of thing. And I just wondered if you had any incentives like CPD points or anything else that might make people kind of want to access it.
Yeah, absolutely. CPD is something we've considered. Again, will probably be sort of a next phase. Again, because at the moment we don't sort of ask for registration for the website, and for CPD you'd need to sort of have that, but we are talking to the companies that do that and looking at that as a next option. We have at the moment got, because the nature of it is sort of, you know, when you do an e-learning usually it's sort of 45 minutes and you have to sit down and do it, and it is a lot to ask for busy healthcare professionals. So this one's designed specifically in the way that you can just dip in and out when you want to. So hopefully if you wanted to know just a little bit about diagnosis, you could just dip in and come back at a later date. It's sort of easy to navigate that way. But absolutely, CPD is something that we are sort of looking at for a next phase. I think it's a really good point. Thank you.
And it may be as well that one of the things we've talked about is we really can't anticipate what are the sections that are going to be more used. So, and it might be that there will be some sections, or potentially you could even argue there could be a whole module that we realize people aren't really using it, and that hasn't been that relevant. So as we start narrowing it down, it makes it a lot easier to start having that. But at the moment, I think we wanted flexibility. We didn't want people to have to register, have to sort of press play and go all the way till the end to get a CPD point. So I think at the moment it's very flexible to give us a chance to see what are the parts that are more relevant, that have more clicks, that people find more useful, and then we get that as a next step. But we've had those conversations for the same reason. Just having a quick look around. Oh, I think there's one in the back. Yeah.
Sorry, it's just one quick question. So we're not under an ALK specialist. We're in quite a small trust in comparison to you larger trusts. How do we get our oncologist to know about this? Because we can sit there and say, oh, this is a new website. It looks really good. You know, Dr. Marrakesh, it looks really good. Could you have a look at it? Yeah. Is there something that's rolled out? Sorry if it's already been asked, but like for these specialist nurses to know, are they going to be flagged up in the smaller trusts to kind of say this website exists? So it's not just come from the patient that likes to kind of, you know, share their views on it kind of thing. It comes from a professional, which might just guide them more. Because in the grand scheme of things, we're this quite little ALK, you know, small population compared to the bigger trusts. So how do we get it flagged up to that professional without coming from us?
Yeah, and I think it goes back to Duncan's point around the comms, what is sort of the comms plan, and you know, with the support that we were discussing about linking this with lung UK nurses as well. So it's trying to get that out there. So we do need to firm up that plan. Yeah. BTOG is one, and I think there's good attendance. So I think BTOG is a very good way of getting that message across many of the healthcare professionals. I think the idea that just emerged about having that leaflet that the nurses could give out to patients when they get diagnosed and seen in clinic, and it's become part of the package. I think that is a very good way of doing that. I think one of the other things we might have to do is go through some of the forums like the nurses, but other forums where we can come and do a bit of a presentation about it. So I think there will be different steps, but I completely agree. Well, we don't want, you are, in a way, your biggest advocates as well, but it can't be just on your shoulders to be telling people about it. So yes, so we have a role to play in making sure that those comms come out, and the healthcare professionals are telling the patients as they are diagnosed about it as well, and they are hopefully using it as well if they need to.
I'd just like to thank Dr. Fabio Gomes and the amazing Claire and Alex they have been amazing. They've supported me with everything associated with this new resource. And as a charity, we will also raise awareness of the website. There's nothing stopping us developing some co-branding materials where we're raising awareness of the support group for healthcare professionals, and at the same time, raising awareness of the website. So I think it's ongoing discussions around how we can support this new resource and make sure that, yes, GPs do get to hear about it, as well as secondary care. But I'd just like us to thank Dr. Gomes for this morning. So I think it's been really informative, and it's great to have heard that after asking the questions last year, they took the feedback on board. As I'm sure you know, as being a patient, very often that doesn't happen. You get asked the questions and no one does anything with the answer. So thank you very much indeed to you and your team. It's a fantastic resource. Thank you.